Today, we're diving deep into something vital: oxygen levels and how dangerously low oxygen can impact your health. Whether you're active, dealing with a medical condition, or just curious about your body, understanding blood oxygen is critical. So let's break it down. What does dangerously low oxygen mean for your health? First, let's talk about what hypoxemia is. This is when there isn't enough oxygen in your blood, which means your organs and tissues aren't getting the oxygen they need to function properly. Normally, oxygen saturation in your blood should be between 95 and 100%. Once it dips below 90%, your body may start to struggle. You might have seen a pulse oximeter, a small device that clips onto your finger to measure oxygen levels. It's common in hospitals and even homes today. But how do you know when those numbers become dangerous? When your oxygen levels drop below 80%, it becomes a medical emergency. Symptoms like confusion, rapid breathing, and even blue-tinted skin can appear, signaling your body isn't getting enough oxygen. This can happen due to various reasons: lung disease, heart conditions, or even environmental factors like high altitudes. But whatever the cause, dangerously low oxygen requires immediate attention. Now, let's break down the numbers. Between 90% and 94%. This range may be acceptable for some people with chronic conditions, but it can be risky for others. Below 90%, you're entering a concerning zone. This is where hypoxemia starts to affect vital organs. Below 80%, this is where things get critical and urgent medical care is required. If you or someone you know is struggling with low oxygen, the first step is to stay calm. Deep, slow breaths can help bring in more oxygen. Medical professionals often use supplemental oxygen or ventilators to get levels back up. Your lungs and heart work hand in hand to deliver oxygen to your bloodstream. Conditions like COPD, asthma, or heart problems can make it harder for oxygen to reach your tissues. Even blood disorders like anemia can interfere with oxygen transport. What about silent hypoxemia? This is when oxygen levels are low without obvious symptoms, making it even more dangerous. Monitoring your levels is key. Let's talk solutions. Oxygen therapy is one of the most effective treatments for hypoxemia. Whether it's through a nasal cannula, face mask, or ventilator, these devices can restore your oxygen levels. Depending on the severity, medications or even surgery might be necessary. Want to stay proactive? Use a pulse oximeter to regularly monitor your oxygen levels, especially if you have lung or heart conditions. Even smartwatches these days offer blood oxygen monitoring. However, it's important to note that these devices aren't as accurate as medical-grade tools. So who is at risk for dangerously low oxygen? Here's a quick rundown. People with chronic lung diseases like COPD or asthma, those with heart problems, smokers, older adults, people living at high altitudes. Lifestyle choices like smoking or lack of exercise can also put you at risk. Keeping your lungs and heart healthy through exercise and a balanced diet can make a huge difference. So, how can you protect yourself from dangerously low oxygen? Stay informed, monitor your levels, and most importantly, seek medical help when needed. Don't wait until it's too late. Your body depends on oxygen every second. Thanks for watching, and if you found this helpful, don't forget to like, subscribe, and share this with someone who could benefit from the info. Until next time, breathe easy. For more health tips and to learn how to support your oxygen levels naturally, check out www.oxygenmax.com. Stay healthy, stay informed.